So those is important, that if child is not making that eye contact, that's the first primary red flag sign.
And so easy to spot.
Absolutely. Screen time, too much of screen time early. It's not only the screen time, it's also the radiation which comes from them. Acceptance needs a lot of resilience. Acceptance needs a lot of support.
That any message for parents with autistic children?
Never give up. Never give up till your last breath.
Hi, I'm Manjula and welcome to the Art of Parenting by Planet Spark, where we raise ourselves first as parents before we raise our children. And today, I have one very special man, the man I have a deep personal connection with. Why? I'll tell you a very, very special story from my personal experience. My sister's name is Natasha Chauhan. She has a special child, an autistic child. Her name is Anatya. And when we got to know about this, we didn't know at that point what to do, where to go, what to do, what is it all about. We didn't know what autism is. We didn't know what ADHD is. And my sister told me that she needs somebody, some expert in this field, somebody who would not only understand just the medical part of it, but also the emotions attached to that. So I did a lot of research online and we checked, talked to many people, and that research led me to this man over here. Dr. Deepak Gupta. I have a deep, as I said, personal, emotional bonding with him because Anatya, my sister's daughter, in his care, in his center, not only that she started responding to her name now, the person who was not, talking and not even responding to her name, she's responding to her name. She not only is going to a normal school, but is doing really well in school. And of course, she's a happy child. And the kind of support my sister got from his center was amazing. So today on this channel, we are going to understand what is autism. So first of all, let me tell you a little bit about Dr. Deepak Gupta, though he needs no introduction. But of course, he's been in this field. He's a psychologist, not just a child psychologist, but also, adolescent care also he takes care of. And he runs this amazing center called CCAW in Delhi, one of the best centers when it comes to autism and dealing children with special needs. And today, I have the pleasure to welcome this man, this angel, Dr. Deepak Gupta. Welcome to our show.
Yeah, thank you very much. Thanks for organizing this podcast. Thank you.
Sir, I'm very happy. I know that you're very busy, but I'm happy that you took out this little time for us. So, of course, my very first question is, how is it that what we don't know autism is, like what is autism, what is ADHD? Like personally, I didn't know anything about it, but when it happened in my family, that was the time I wanted to know all about this. So for a layman, can you please explain what is this?
See, autism and ADHD both are neurodevelopmental disorder. The main difference is that in autism, the child is lost in his own world, self-absorbed in his own world. Child doesn't make eye contact. It does not respond to the name. It does not pinpoint at things or doesn't show us when he gets hurt. And is in his own world and playing with his body parts or playing with the parts of some object. That is autism. In his own world. But ADHD kid is an extrovert kid or can be outspoken, can start playing with others, is overactive, full of energy, is running here and there. In the class also does not sit at one place, moving from one place to one place, lack of attention span, poor concentration, getting distractible and not able to finish work, impulsive, cannot wait for his turn, not able to stand in queue. That is ADHD. So if you want to demarcate between two, is that autism, a child lost in his own world and not responding to the outer world. ADHD child full of energy and everywhere.
Oh.
That is ADHD in a simple way.
Thank you so much. And also I wanted to know, are there any reasons for it? Why does it happen to certain kids and not to everyone?
Yes, definitely. Still the reasons are not very clear, but their reasons are there. If we talk from the autism and ADHD, both are neurodevelopment disorders, there are enough theories are there. Some are biological theories are there, and which says that autism runs in family or ADHD runs in family. Okay. So there is a strong genetic family history. whether it's autism or ADHD. So that means if your parent has autism ADHD or if your sibling has autism ADHD, then the child has a high risk for autism and ADHD. That is from a genetic perspective.
Okay.
If we talk from the other biological perspective, what they're talking about, the pregnancy, the stress during the pregnancy, the complication during the time of delivery, and some people are even talking about that increased number of cesarean sections. Some people are talking about reduced amount of breastfeeding. All that are linked to the autism spectrum disorder. So people are trying to link with these, all are hypotheses, but yes, some papers are there which says yes, they all are contributing to it. Then what is also coming up is that as the child is born or even the pregnancy, the mom exposure to toxins.
Okay.
And we know that we are living in a toxic world today.
Yes.
We are living in one of the most world polluted city, Delhi, NCR. So the toxins exposure to the mother and the toxin exposure to the child in the first 2-3 years, they also contribute to it. And that is where the autism comes into in front. And that's where we see the children, once they're 2 years, 3 years, gradually we start seeing the signs and symptoms of autism. That is what is it. So all these adds on. So it's not one theory, it's multifactorial. Okay. It's not that we can only say. So it's what they say, it's a combination of biological and environmental.
Okay.
And these biological, environmental, they both play like together. They are playing like a deadly combination. And this environmental factor, they triggers
so
a person who is genetically predisposed. So that is what happens is that. So a person who is genetically predisposed or vulnerable, this environmental factor triggers it. And once that triggers it, so then the child goes into signs and symptoms which are called as autism spectrum disorder. That is what is that. And that's what the people are saying, that is one of the hypotheses, people who believe into it. That is the reason why autism is on the rise. Why autism children the numbers are increasing more and more. Yes, definitely we have become more aware to autism. More screening is happening. We are identifying more. It is autism spectrum disorder now, unlike before. Those factors are there, but such an exponential increase
that we are seeing now.
That is where the epigenetics and the environmental factors are into play. That is what is becoming more and more visible. It is there. Okay. And in this environmental factor, another factor is electromagnetic radiation.
Yes,
the great gadget. So children exposed to this screen time, too much of screen time early. It's not only the screen time, it's also the radiation which comes from them.
Yeah.
So all that also triggers them. So this is all part of the epigenetics which makes them go into autism spectrum disorder. And a lot of research is happening on the field of epigenetics, and people are trying to understand, are these environmental factors, the hypothesis which has been created, are they really true? Are they artifact? But yes, what my experience says, and working with so many kids, the autism spectrum disorder, to me it looks like that environmental factors are contributing in a very, very big way.
Okay. So also, are there any types, like for example, there are a lot of autistic kids I have seen in life, like in case of my, sister's daughter, she had mild symptoms and her, I think, spectrum, she's at the lower end. But then I've also seen certain kids who get really aggressive and they can't even physically also, it affects them, not just mentally. So are there any broad categories, like broad types?
So broad categories, what initially people were talking about mild, moderate, severe, mild type of autism, moderate type of autism, severe type of autism.
Okay.
Now, the newer classification made it level 1, level 2, level 3. When it is level 1, you need less support.
Okay.
They are the children who can be mainstream,
okay,
who can go to a mainstream inclusive education setup. They need less support. Level 2 are there who needs more support. Okay. And for them, inclusive education may be difficult. So they have to be set up into an integrated setup or with more support. Okay. Level 3, who needs more of a special school or who has to be at home or residential homes and who requires more support. Okay. So on those basis, it's level 1, level 2, level 3, mild, moderate, severe has been the broader way. That's what usually the simple classification.
Okay. And any early symptoms?
That is very important. See, people, I think through your podcast, we can break the myth. We can identify children as early as possible, even at 9 months.
Oh, that's...
You can identify a child who is almost stepping into,
Okay.
who is having a risk to go into it by 9 to 12 months also.
Oh, wow.
We don't have to wait till 3 years for a child to show all the symptoms. See, after 3 years, the child has shown all the symptoms, 3 to 4 years, then we start all the interventions. But when you identify a child at 1 year, 1.5 years, 2 years,
Yeah.
you put early intervention,
Yes.
and that is a game changer.
Okay.
That's what. So important thing is that start early. Jitna jaldi, utna behtar. I keep on always saying this line in my all the telecasts that jitna jaldi, utna behtar. Don't worry for the formal diagnosis.
Yeah.
You don't worry for that big report.
Yeah.
And which will make you a little bit sulk and which will make you feel down, depressed. Down. No. Start early. Maybe the report may change.
Okay. I love the line जितना जल्दी उतना अच्छा. So लेकिन symptoms जैसे कैसे identify कर सकते हैं?
बहुत important question आपका. देखिए 9 to 12 months में the first thing we can identify is the eye contact.
Okay. Yes.
So अगर 9 से 12 महीने में 9 to 12 months, if child is not making eye contact the way I am making eye contact, you to Manjula, if the child is not making, correct? See, that is the time the mother starts using motherese, baby, Boshona, baby, baba, beba, and the child looks back.
Yeah.
Correct?
Yeah.
And then they say, okay, Johnny, the child looks back.
Yes.
Correct? The child makes an eye contact. The mother is giving a feed, and while doing feed, in between, the child takes a break, looks at mother,
Yes.
little bit gulps, and again start feeding.
Yes.
Start taking breastfeeding. So those is important that if child is not making that eye contact, that's the first primary red flag sign.
And so easy to spot.
Absolutely. You don't need high-tech instruments for that.
Yeah.
So that means you know that something is so. So 9 to 12 months, the child should have ideally can develop by 6 to 7, 8 months also. But 9 to 12 months can make you. And then if it's there, then you as a caregiver have to start intervention.
Yes.
Why my child is not giving an eye contact by 9 to 12 months. Rest other symptoms by 16 months or by 18 months like lack of pinpointing. The child should have started pinpointing at things.
Yeah.
And while pinpointing, start looking at you. So if I'm pinpointing at him and then looking at you, that is the way the joint attention would have started coming up.
Yes.
So if that's not there, by the age of 2 years, then the speech, the words should have come, few vocabulary should have increased, few words should have started joining up.
Yeah.
But that is by the age of 2 years.
Okay.
Clear?
Yeah.
And then the other symptoms start coming up. Some regression starts happening up. So the regression can happen between the age of 1 to 4 years.
Okay.
The child who started few words loses the words. The child who started making eye contact loses eye contact.
Okay.
The child start giving the hug or playing suddenly gets into their own world. That's a regression. Okay. And if any child regresses, think of autism spectrum disorder.
Okay.
So if child does not have eye contact, think of autism spectrum disorder. If the child regresses in any domains, think of autism spectrum disorder. If the child lacks pinpointing, think of
Autism
spectrum. So these three are the things which you can pick up at the early, from 9 to 12 months, 16, 18 months and this. So in that way, so the other signs and symptoms are there, but these are something which a common man can pick it up.
Yeah.
You know, that's what is there.
And as I said, these are easy to spot.
Absolutely. But and other signs like the child in his own world, playing in his own world, or playing with one object again and again, like a wheel of the car, like playing with the fingers, playing with the thread, playing with strings, playing with only pen caps only, and that gradually become visible by 1.5 to 2.5 years. And then gradually other symptoms starts coming up. You know, sensory issues like sensitivity to sound, to smell, to lights, to noise, you know, spinning, you know, vestibular issues, want to revolve again and again. So touching things, you know, all those things starts coming up.
Okay.
But we need to identify early.
Early
That's
symptoms.
the important thing which I want to convey is that jitna jaldi utna behtar. One symptom is a big red flag signs. Autism is a journey. Can we make a dent early and change the trajectory? That should be the mission.
Yes. Jitna jaldi utna behtar, as Dr. Gupta said. So this question I really want to ask you. This is one question that keeps coming to my mind also for my sister's daughter. Is it completely curable?
A tough question to answer, but I'll put it into a very simple way. And I'll put my experience and the scientific study together.
Yes.
And that says 25, 25, 50. जिसे मैं कहता हूँ 25, 25, 50.
Okay.
25% of the kids come out.
Okay.
They lose their diagnosis.
Okay.
25% of the kids, they improve, but they remain in their diagnosis.
Okay.
50%, they struggle with their symptoms.
Okay.
Correct.
Got it.
That's a very simple way. But a lot of people say nothing can be done.
Yeah.
A lot of things can't be done. It will be like a burden to you. And that gives a lot of pessimism to the parent community. What I'm trying to make it simple is that there is a lot of hope and a lot of love in this
Yes.
spectrum. Correct? It's a big word. Autism spectrum disorder is like an ocean. But you have to dive into it.
Yes.
And then only you can learn how to swim. But you have to do it for your child. That's the important thing. बच्चे के लिए इंसान कुछ भी कर सकता है और हमें करना भी चाहिए.
Yes, sir.
Correct? That's what I believe. So important thing is that when we have this, so a lot of people comes to me. So my thing is that creating an hope. But you don't have to create a false hope.
Yeah.
But I tell them 25% is a big number.
Yeah.
And I have so many kids with me who have recovered.
Yeah.
I have so many kids who have come out of it. But yes, so many kids are there who are into the middle one, who have improved but not totally come out of it. And one of them is your sister's daughter, is that. But if you're able to come to that point also where the child improve and able to go to mainstream, enjoy life, be happy, and no behavioral issues, and gradually start, becoming a part of the bigger world.
Yeah.
That's what gives a lot of happiness to parents.
Absolutely.
So that's what should be our main. And when the parent comes to us, when you tell these figures to them, they go out of your chamber, out of your room with a lot of optimism.
Yes.
हाँ, कुछ हो सकता है, कुछ कर सकते हैं. पहले 25% या पहले 50% के लिए मेहनत करते हैं. That's what I tell them. Let's work for the first 50%.
Yeah.
Correct?
Absolutely. From, again, as you said, that बच्चे के लिए तो इंसान कुछ भी कर सकता है. So from parents' point of view, what can we do as parents if we get to know that our child is a special child?
See, first thing is once you get diagnosis, you need a lot of psychoeducation. You need a lot of reading for yourself because you don't know what is autism.
Yeah.
You don't know where you're stepping into.
Yes.
So you need a lot of learning material for yourself. Somebody need to educate you, somebody need to tell you, and you need somebody to educate you.
Yes.
So once a diagnosis is made, then a lot of psychoeducation is important, a lot of learning material is required because then only you can take the step. And then you need a good team of therapists.
Yes.
Good team of occupational therapists, a sensory integration expert. You need a good team of ABA, special educator. You need a good team of speech and language therapists. So all are placed by a team.
Okay.
So you gradually start with one by one and gradually see as per the child's strengths and difficulties, as per the child's requirement, you introduce. Mostly people introduce sensory integration occupational therapy starting and the other therapies are put into place later.
Okay.
Some people start with occupational therapist along with sensory integration and a special educator or your ABA initially and gradually introduce speech and language as per the age of the child, as per the developmental level of the child and as per the requirement of the child.
Okay.
So it's not like a blanket that every child is loaded with it.
Yeah.
You have to make a plan. And that's where you make a plan for the child. So individualized plan should be made for every child.
Okay.
And according to that, it should be implemented. That's important thing. So what I'm trying to say after diagnosis, education, and then a good team of therapists.
Yes.
Then individual plan for the child, and then the monitoring very important.
Yeah.
We are little miser in monitoring. So what I mean to say is that a monitoring and a follow-up progress is important.
Yes, absolutely.
So when we should have targets every 3 months.
Okay.
Some people want to have every month target, but that becomes too much for a child of this thing. But yes, if you can make a monthly target, very good if you have that much of competency. But at least we should have every 3 to 4 months target. We follow up them After 3 to 4 months, give a feedback to the parent what we have achieved. Because parents will also feel optimistic. Yeah, we had 5 targets, we have achieved 2. Now, let's work more.
Yeah.
So giving a feedback, empowering the parents, that's important.
Yeah.
Empowering the parents by giving the right feedback and telling them micro gains. In this field, we work with micro gains.
Absolutely.
It may not be 30-40%.
Yeah.
It may be 5%, 3%. Showing them that, see, we achieved this 5 to 10% micro gains in this last 4 months. So everything is possible.
Yes.
We need more. So giving that sort of a confidence to the parents by right reflection. So in this way, and then once we have done monitoring and then reviewing the plans, this should be the done. After that, other medical interventions are coming to place.
Okay. So I just want to give you again a personal example here. My sister's daughter, Anatya, who never used to respond to her name. So this is a very small thing. Like for us with normal kids, we always think that, okay, fine, yeah, I'm calling his or her name and the child is responding. But she never used to respond. And after few days of therapy here at the center, she started responding to her name. So that also for my sister was a very, very big achievement. So that's why parents, whatever they teach you here or whatever, anywhere you read about it, please follow up also. That's very important. So, okay, another very important question. Acceptance in the society. Do you really think that India is ready for such children, or are we doing enough for such children?
Acceptance takes time. Acceptance needs a lot of resilience. Acceptance needs a lot of support. Because once you start accepting, you're able to digest it. And once you're able to accept it and digest it, you're able to acknowledge, you're able to take actions. Because if you have, a lot of parents struggle to get that acceptance and they remain in denial. And so that's why I said that once you get acceptance, so for a mother can accept, but if she doesn't get support from her family,
yes,
for her acceptance becomes quite dicey. If mother doesn't have her own support system in place, or how she will build resilience, because then acceptance will get dicey. If my child really in it, should I work on it? Should I not work on it? Should I leave it to God? Should I not leave it to God?
Yes.
Am I angry with the God? So all these will come internal part of the acceptance. Once you know you have support, and then you start working on it, then your acceptance becomes more and more into it.
तो सर एक और चीज which I have noticed that parents also need counseling, like
Absolutely.
Because for us we believe that just the child needs counseling, but parents also. So you provide that.
Absolutely. देखिए जब तक parents don't understand what is autism, and parents don't understand that why autism has happened, they will not invest in the child. Let me tell you. Yes. So simultaneously important is that, and simultaneously, some parents, a lot of parents who comes to us who have read about autism, when the word autism comes to line right from a doctor, like a doctor like me, it shatters your world.
Yes.
It's like a feeling like, what has happened to me.
Yeah.
A lot of guilt comes into them. Why my child?
Yes.
All these questions comes into
That's
them.
the first
So important thing is that counseling a parent, giving a support, hand-holding is very, very important. That's what I meant by educating. So when you educate the parents, you do hand-holding and tell them it's a journey, we'll bring it out.
Yeah.
And let's work on it. So they get they get empowered. So parent counseling is not only giving them the education, medical education, but simultaneously along with education, empowering them. Yeah. That's the purpose. And it's ongoing. It's not, you can't do it in one day.
Yes.
And that's why you need a very sensitive therapist. You need a good team of therapists who remains in this philosophy. Who doesn't say, no, आप काम क्यों नहीं करते, आप समझते क्यों नहीं हो, क्या कर रहे हो आप, आपकी वजह से ऐसे हो गया. So we don't have to create that fear or guilt in them.
Yeah.
We have to keep on empowering them so that they are able to do at home. Because they will come to therapy center for 2 to 3 hours or 4 hours or 3 hours.
Yeah.
Rest 21 hours has to be dealt by 20 hours with the mother.
Yes.
So empowering the mother, and becoming a support system for the mother and taking in that journey is important. And that's what I do. So I try to make sure that in my every session, whenever they come to me, when I review with them every 2 months or 3 months, I empower them. I tell them, yes, it's possible. Doesn't matter. The last 1 month could be difficult, but doesn't matter.
Yeah.
This in the coming months will be powerful. Coming months will empower us. Coming months will be good. So in that way, counseling is an ongoing process with this in this community.
Okay.
That's what.
And so again, are there some activities that parents can do at home?
Absolutely.
Like simple ones.
Absolutely. See, when you involve a therapist, the therapist do a lot of activities in the therapy sessions.
Yeah.
And along with that, educate the parents or give a home plans to the parents.
Okay.
So in that way, there are multiple their resources are there. So those lot of resources and materials, those are used by the therapist, and same thing is reflected back to the parents.
Okay.
What they should do it. Okay. So the thing is that from the therapist setup, it is taken to the home setup so that things can get generalized.
Oh.
And there are so many innumerable activities with the therapist involved, from putting into the beads, to the clay, to the putty, to jumping, to on the trampoline, to on the ball, gym ball, and to blowing, to sucking, to bubbles, to coloring, to fine motor, grace for blowing, massage. There's so many activities are there. I've just given a rough name of them.
Yeah.
That's what is there. So all this becomes part of the therapeutic plan by the therapist, working in collaboration with the parents. But one thing I want to say that it's not only therapist, it's therapist in collaboration and cooperation with the parent.
Oh yes.
You get the desirable result.
Absolutely.
And along with that, my biomedical thing, which I use very prominently, and there I again require a lot of support from the parents, including diet, including biomedical supplements, and that makes a perfect combination.
Okay. About this center, CCAW, how did this idea came to you and why?
See, while I was in London, and before that while I was in Valanazad Medical College, I felt that child mental health will increase. So I had speculated long back that child mental health will increase.
Visionary.
Yeah, and when I went to London, I saw a structure, the way they work. Yeah. When I was working in Michael Rett Center, Maudsley, I saw how they work as a team. I felt that we need to have a team for child mental health.
Yeah.
And that's where when I came back to India, I thought of this idea, CCAW, Center for Child Adolescent Wellbeing. Today we have a team of 30 to 35 professionals, along with admin staff works with us in a complete way and supporting and providing care.
Okay.
Over the years, we have evolved. Over the years, we have added technology also in our intervention. We have added a lot of biomedical interventions. Yeah. We have involved neuromodulation also in this. So a lot of things have evolved over the years. We try to work with the parents, focusing only on the child and catering to the individual child's needs, strength, and the challenges.
Okay. Sir, another important question, that are there any tests that can be done during pregnancy? Why can't it be diagnosed during pregnancy?
Your question is very, very important, and a lot of parents ask me, but we don't have any specific genetic test for autism.
Okay.
At this point of time.
Okay.
Maybe next month or next year to talk to me, maybe I may say, yes, we are out of it. But a lot of research is going on. But currently, we can do other markers, and other markers are there, but not for autism specifically.
Okay.
That's what.
Okay. Also, I wanted to know, what is the future like? Because I've heard so many and I've read it at many places that the cases of autism are on the rise and they're going to increase. So what does the future look like?
See, the number will keep on increasing, no second thought.
Okay.
Right now, when we are talking about the figures from 1 in 32 to 36 at this point of time, the people are speculating to become the figures to 1 in 10. Okay. That's what the numbers will increase. So one thing clear is the numbers will increase. The policymakers, health workers, medical expert have to come together, which they're doing in the best capacity, so that we can have sort of a rigorous sort of implementation. What can be done so that these numbers does not increase further? And I think a lot of thought has to go into this. Why this thing? And I believe the breakthrough will be in epigenetics only. The epigenetics will be a game changer. Epigenetics will be the science and will be the future which will bring, yes, autism number does not increase. So we need to look into that model. And I believe as a child psychiatrist, as a person working in the field of this thing, yes, once it happens, it happens. But can we do something so that a child between the age of 1 to 3 years does not go into the journey of autism?
Okay.
And that will be the future.
Another important question, sir, because, there are a lot of people who have this question that whether they should put their child in a special school or a normal school.
See, all this depends on the level of the child.
Okay.
All this depends on the behavior of the child. All those depends on the strength of the child. Important thing is that.
Okay.
If the child is level 1, if the child doesn't have behavioral issue, then definitely the child will go to mainstream inclusive education. Why you want to put it into special school?
Okay.
But is a level 1 child also having a lot of behavioral issues? Correct? Not getting settled even after with a shadow teacher or assisted learning teacher.
Yeah.
Then you have to opt for either a special school or for a residential. So it all depends on the child to child.
Okay.
Absolutely. So I have a lot of children who are level 1 going to normal mainstream school and they're doing well.
Okay.
If that's what. But we need support from the school. The openness from the school, along with parents' continuous work with the child and supervision by therapist and a medical expert like us, helps to bring the child and helps the child to have a smooth journey in the school.
Okay.
Because a lot of things will happen.
Yeah.
Some children may bully, some teachers may not be comfortable, the support system may not be there, resources may not be there, learning centers may not be fully equipped to handle the child. So all those things are there. But it's a journey.
Yeah.
And I know some of the schools, they do a fantastic job. They've never given up.
Yeah.
And they're able to provide support. That's important, isn't it?
Yes.
The legal system says every child should be given an opportunity in a mainstream inclusive education.
Yes.
But
Yes.
a lot of ifs and buts,
Yeah.
those has to be taken care of.
And any support from the government?
Yes, the government support is too much. And that's why I use too much is that so much support is there, but we have to take advantage of them. Correct?
Okay.
There we have a lot of we have Disability Act is there, and provision for Disability Act is there, where a lot of provisions are provided. They are there at every level. We have support from the school and CBSE. In the schools are there, and there. We have a lot of support in the income tax and other monetary support is there. Those things are there. So all those things are into plain place.
Okay.
Correct. There is a provision of making a disability certificate is there. Then UDID card is there. So once those things are there, then other advantages you can take of it.
Yeah.
But important is that the awareness is not there.
Okay.
The government has to make sure that there more awareness are there.
Yes.
There are more people to conduct those disability assessments and provision of certificates.
Yeah.
Now, if their provisions are there, but unless the children are not assessed for this level of disability and disability assessment is not done and the certificates are not issued and UDID card have not made, then the children won't get advantage.
Yes.
Important is that the implementation is important. But yes, government has given a lot of, even the new education policy which is about to get rolled next year completely in 2026 across the country, have a lot of provision for these children.
Okay.
But the only thing is the implementation
And awareness.
along with implementation awareness, and then yes, the stakeholders should take advantage of it
Yes.
for the best interest of the child.
Absolutely.
That should be there.
So another important question, how can they contact you, like when the child is diagnosed with autism? So how can they contact you?
We have a website. Our CCAW has a website, and do definitely welcome to visit that. We have a website for the biomedical autism website also, biomedautism.in. We have a website there also, and definitely we are easily available. You can always approach on the Google. Through Google, you can reach to us. You can email to us, and absolutely we're always welcome to help. That's what we are doing it in the last 3 decades.
Thank you.
But I just want to, last point I want to say that
absolutely.
every child can behave. Every child can reach to its maximum potential. It's only the people around that child, how much they can bring best out of the child. That's important. हर बच्चे में क्षमता है, वो हम पे निर्भर करता है कि हम हर बच्चे में कितना उसकी क्षमता को निखार सकते हैं.
That's what I wanted to ask you, that any message for, parents with autistic children?
Never give up. Never give up till your last breath. And remember, it's your child. जो आप कर सकते हैं कोई और नहीं कर सकता. You are the best counselor, you're the best teacher, you're the best mentor. So never give up. And in this journey, both the parents, husband and wife, have to hold the hand together. A lot of conflict will happen, a lot of guilt will come, a lot of arguments will happen. But आपका सफर दोनों मिलके एक दूसरे के साथ बच्चे के लिए काम करेंगे तो बच्चा अच्छा करेगा ही करेगा. I have so many families where the parents kept on supporting and they have never given up, whether it's a level 1, level 2 or level 3, and they're happy.
Thank you so much for coming on our show. You're doing incredible work, you and your team, of course, and wishing you all the health, all the happiness and all the luck in the world, wishing you even more success. Together maybe, we can create a society that accepts everyone as they are.
Thank you very much. Thanks for this podcast. I'm sure with this podcast, we'll be able to reach to the hooks and corners of the country and to the world, and we're able to spread the right messages. Yes, we can make a difference. Thank you very much. God bless us all.
Thank you, sir. Please remember, autistic children just look at the world from a different angle. All we need to do is just change our angle. And for all the parents dealing with special children, there's a quote that I had read, a beautiful one, that autism doesn't come with a manual. It comes with a parent who never gives up. So I hope this session with Dr. Deepak Gupta gave you insights into autism. What does the world look like for them? What does the future look like for them? For any details about him and his center, the details are given in the screen below. Do check it out. And for more parenting tips, for more such mindful parenting tips, please follow us on The Art of Parenting by Planet Spark with me, Manjula. And to make your child a confident communicator, please make sure they join Planet Spark's online classes. Just log on to pspark.in and book your free trial class today.